Today I'm going to be talking to you a little bit about the guidelines for physical activity. And the first thing I'm going to talk about is who should exercise. And the answer to that is everyone can exercise to some extent. It should be adjusted to your own activity level and your own abilities. But whether you're chair or bedridden, and that just involves you moving your arms or your legs, or whether you're actually mobile and on your feet and you can get up and move around. The amount and type of exercise will differ based on your age, disability, and chronic health problems, of course. But the types of exercises that you can do include endurance exercises, which is like walking, jogging, dancing. Strength training includes lifting or pushing free weights, or also exercises involving like resistance or stretch bands. And balance exercises can be things like back leg raises, side leg raises, toe stands, and also heel toe walking. And stretching and flexibility exercises are things just like stretching different body parts. A lot of times this might include like just warming up before your regular exercise regimen. And yoga is something really great that kind of combines a lot of things together. You might get a little bit of endurance, and also some stretching and flexibility, and also balance, incorporating that as well. Next, we're going to talk about safety tips. You should always start out slowly with low intensity exercises when you first start your regimen, and also to warm up with. And you should always consult your doctor before starting an exercise routine. You always want to talk to them if you have problems, especially like diabetes, heart disease, if you're a smoker, you have respiratory illnesses, if you are overweight or obese, and if you have an acute blood clot, because those exercising can, if you're not healthy enough for it, can cause some problems for you. It is important to wear appropriate, comfortable, good-fitting shoes when you're performing your exercises, loose-fitting clothing so you can move around. And also, it's important to drink water before, during, and after your exercise. It's vital that you stay hydrated during that. And also, when you might be outdoors exercising, you need to really pay attention to your surroundings, whether you be walking up and down the road, and you need to be aware of traffic coming, or whether that be the weather. Maybe it's been raining outside, or it's been snowing, or might have a little bit of ice that's frozen over. You need to be aware of that so you don't fall. And also, you need to be aware of uneven walking surfaces. You might stub your toe on something, and the next thing you know, you're falling down. Or also strangers, you need to be aware of that. Make sure that there's no unusual people around. You should always stop exercising if you have any sort of chest pain, any kind of pain that radiates to your neck, shoulder, arm. If you feel dizzy, you feel nauseated, if you break out in a cold sweat, if you start having extreme muscle cramps, that can sometimes be a problem of an electrolyte imbalance, or also like heat exhaustion or heat cramps. If you feel any sort of severe pain, that could be maybe an injury related, or if you feel short of breath, you should always stop exercising. Lastly, we're going to talk about setting exercise goals. And the recommendation for older adults is 150 minutes of exercise per week. And this doesn't necessarily mean that you need to do 30 minutes 5 times a week. They recommend that it is at least in 10-minute segments. So if you want to do a couple of 10-minute segments every day, then that will be up to you if that works out better for you. It's important to talk to someone to help you develop an exercise plan, whether that be a healthcare provider or someone at a fitness center or wellness center, or whether even that's just maybe a friend you have that's more experienced with exercise. They've been exercising for longer, and they can give you some advice and tips on developing a plan and actually getting a routine started so you can stick with it. And lastly, it is important for you to set short-term and long-term goals, whether that be If you're mobile and you say, hey, I want to walk 30 minutes a day, 5 times a week, and then in 6 months from now, I want to be able to walk a mile without stopping. Or whether you're someone who's chair ridden and you want to say, hey, today I want to start doing 10-minute segments of arm and leg exercises while I'm in my recliner. In 6 months from now, I want to be able to have better range of motion where I can stretch a stretch band all the way out to here. And you just need to discuss that with, you know, your doctor or whoever may be helping you set up your plan.